All right, I think we can go ahead and get started. Good morning again. My name is Amy Dearmore. I work here in the Office of Community Living at the Department of Healthcare Policy and Financing, and I am so happy to have you all join us this morning and really happy to be talking about a new upcoming program, which is Long-Term Services and Supports Presumptive Eligibility. And because that doesn't exactly roll off the tongue, well, the acronym that we like to use is LTSS PE. The purpose of this program is, or I'm sorry, the purpose of this meeting is number one, to provide you with an overview of this program, especially if it's something that's newer to you, provide you with some program updates, and thirdly, allow you all the opportunity to offer feedback or questions as they arise. This meeting is being recorded, so please so please refrain from offering or providing any personal health information during the meeting. Also, as I'm going through the slides, please feel free to come off mute and ask questions as we're going along. I may not see any questions that are entered into the chat until towards the end of the meeting, but at the end of the meeting, I will check the chat for questions. I want to start off by highlighting the mission here at HCPUF, which is to improve healthcare equity, access, and outcomes for the people we serve, while saving Coloradans money on healthcare and driving value for Colorado. The Department of Healthcare Policy and Financing administers Health First Colorado, which is Colorado's Medicaid program, Child Health Plan Plus, and other healthcare programs for Coloradans who qualify. Just to provide you with a brief overview of this program, LTSS PE will allow those in crisis situations to access select services and supports while their long-term care Medicaid application is being processed. This program will be available to adults who attest to meeting HCBS or home and community-based services financial and functional or level of care eligibility criteria. Individuals will also self-attest to meeting the aforementioned crisis criteria. Here's a little bit of what our journey has looked like thus far. In June of 2024, we received legislative authority through House Bill 241229 to pursue presumptive eligibility for the LTSS PE population. We have been doing a ton of outreach to different stakeholder groups, including counties, case management agencies, adult protective services, transition coordination agencies, service providers, those in the medical community, just to name a few. In fact, to date, we have outreached external stakeholders about 47 times. And that number, 47, does not include the many internal meetings held within the department across various offices to ensure alignment and to help with program development. Third bullet point, we are looking to implement this program through the expansion of Colorado's 1115 demonstration. 1115 demonstration waivers allow states the flexibility to pilot new programs. So Colorado is asking permission from CMS, or the Center for Medicare and Medicaid Services, to expand our 1115 to include presumptive eligibility for LTSS. As of right now, what's happening with our application is, very excitingly, it was officially submitted to CMS as of December 23rd. It was a long journey to get there, so we're really excited about that development. Currently, the 1115 application has entered a 30-day period of public review and public comment at the federal level. Towards the end of this presentation, I will post the link in the chat so you can view not only the 1115 application, but also all of the comments and eventually the responses that come in surrounding the application. And you will be able to view the application. And just a note, it is a really lengthy document. So not only will you see the LTSS presumptive eligibility part, but you'll see all the components of the 1115. And a fun fact, in case you don't know, if and when this 1115 is approved, the new name of our state's 1115 will be Comprehensive Care for Colorado, which has a nice ring to it. Fourth bullet point, our targeted implementation date is January 1st of 2026. And so now that we are just under a year out from implementation, we have really hit the ground running in 2025 and are really excited about the updates and progress that has come and that is coming shortly. And while CMS is currently reviewing our application, there isn't a lot that we can really firmly say, this is what we're doing, this is what we're moving forward with, because we don't know what they're going to approve, what they're going to have questions about that we may need to adjust, what they're going to not approve. Um, but among the things that we can officially firmly say that we are recommending are these things. We're recommending that there will be entities who will provide crucial roles unique to LTSS PE. These will be roles that will be new with the implementation of the program. We're recommending that for case management agencies and counties, their timelines within LTSS PE will remain largely as they are. Current roles, current processes, current timelines. We're recommending that a small group of services will be provided to individuals during the LTSS PE period. These will likely be services that include things like personal care, relative care, homemaker, home modifications under the $2,499 mark, respite, a personal emergency response system, home delivered meals, if I didn't say that already, as well as plan benefits that include acute long term home health and targeted case management, transition coordination. Fourth bullet point, we are recommending that we implement an LTSS PE referral form that is available online and will allow the self-declaration of meeting level of care or functional eligibility for HCBS, which is Home and Community-Based Services, financial eligibility for long-term care Medicaid, and attest to meeting defined crisis criteria. Excuse me, just a second. So here's an overview of what we what we believe that this program will look like. The different colors of boxes that you see represent different entities or individuals who will play a role within the LTSS PE program. I mentioned that there are two roles that will be brand new as a result of the LTSS PE implementation. The first one is the top row, which is the light orange box. This is who we're calling the enrollment coordinator. This will be someone who receives the LTSS PE referral form that will again be available online. They'll screen it for completeness, call the individual, kind of verify the information, explain next steps of the program, ensure that someone's initial or MAGI Medicaid application is submitted. They will serve as a point of contact between the county and other entities, and they will track someone's eligibility all throughout the LTSS PE period. Second row down, is where the county comes into play. They'll receive the application, open the case to process someone's long-term care application, and follow current regulated timelines and processes through enrollment or eligibility determination, rather. Third row down, kind of the light pink, represents the second new role that will be created as implementation as we implement the program. And this is going to be an entity who will serve as the facilitator. We're looking at this person to provide a really intensive model of support for the individual throughout the PE period. They'll be meeting with the individual, helping to gather verifications, medical documentation as needed for the long-term care Medicaid application. They'll be initiating and authorizing services, making sure those services are going well, checking in with the individual on a regular basis, as again, they will be in a really vulnerable position, experiencing a crisis. They will serve as a point of contact as needed between the individual and the case management agency. And as they will be conducting a risk assessment with the individual towards the end of their PE period, they may even continue providing some support as the needs are indicated. And then the bottom row, the light blue, is where our case management agencies come into play. They'll be receiving the referral through CBMS/Peak Pro. They'll request the professional medical information page and really just follow their current timelines and processes as someone moves towards enrollment onto HCBS. I just saw that someone requested captions. I did approve that. And so if whoever requested the captions, if you're still not able to see those or access those, raise your hand and let me know. I want to make sure that everyone is able to see and participate. I'll pause here for just a second because I know this is a lot to take in. This is just a small handful of what we are currently trying to work through. There are about 100 things I think we're currently trying to work through with this. Oh, sound is not working. I'm so sorry to hear that the sound isn't working for someone. Is anyone else having sound issues?
Hear you fine, Amy.
Okay. I'm really sorry that the sound isn't working for someone else. So hopefully the captions, if that was you who requested the captions, I hope that that helps that. Okay, thank you. Um, like I said, there are a ton of items that we're working through, but these are kind of what make the short list for items that we're looking at most currently. Number one, the timing of the Medicaid application submission. Specifically, does it make sense for someone to complete and submit kind of an initial or minimal set of information to start the clock, start the process with the county, and then have that program facilitator, of course, help them gather verifications and medical documents and whatever is needed to apply for long-term care Medicaid. Kind of when that initial or MAGI application could be submitted. Does it make sense for it to be completed and submitted before the LTSS PE referral form, for example? Second thing, top on our list is what happens if someone is determined ineligible for Medicaid during the LTSS PE period. Specifically about that is we want to really avoid the abrupt cutting of services for individuals who are in crisis and who have been receiving much needed supports. So what happens if someone's determined ineligible for Medicaid during the PE period? Number three, we're looking really hard at what we can provide consent-wise on the front end to ensure uninterrupted, streamlined processes for the individual and other entities as someone moves through the LTSS PE period. We're wanting to make sure that accessibility and plain language is addressed and that's in place for not only our LTSS PE referral form, but all of the documents needed for the program. And we are looking, of course, at system updates, all the different aspects of all the different systems that need to be adjusted and updated to accommodate LTSS PE. I do want to pause here for a second because especially bullet points 1 and 2 are really hot on our top list right now of what we're talking about. I did want to take a minute to see if anyone present here today has feedback on these two things specifically. Feel free to come off mute if you are comfortable. If not, that's okay too. At the very end of this presentation, I will be providing ways to contact us. And so if this is something that you'd prefer to talk about in a different venue other than in front of 73 other people, understandable. Just know that our lines of communication are open.
Can you hear me okay?
Oh, yeah. Hey, Becky, thanks. I couldn't
Hi,
at first, but now
sorry.
I can hear you.
Yeah. I've been having issues with my mic, so if you can't hear me, just let me know. I do have a question regarding the eligibility for Medicaid.
Sure.
So at the time for presumptive eligibility, if an individual applies and let's say they're already magi and there's an interface in the system, but the individual is attesting or client statement that they no longer have a resource, is that interface going to trump the client statement and we act on it and deny at that time? Or do they fill out like a self attestation saying, I don't have these resources, and we move forward with the presumptive eligibility?
This is a really good question, Becky. I don't know that we have really considered this. I haven't been able to think through this exact scenario.
Mm-hmm.
Um,
Okay.
so your question is, if someone is already on, I'd like to actually take down your question. Would you mind repeating it
Sure.
for me, please? Thanks.
Sure. So if someone is active on Magi Medicaid, let's say they're adult Medicaid, and now they submitted the presumptive eligibility application because they're in need of assistance, right? They meet the criteria for the emergency assistance. While the eligibility technician is processing the case, let's say there's an interface in the system declaring a resource or some type of income that technically would put them over. Is that going to trump the presumptive eligibility criteria where it's basically client statement, but we see the interface there and we can move forward and deny? Or would the individual sign like a self-attestation form stating they no longer have that resource and we move forward without eligibility?
This is a great question. I guess within LTSS PE, we're not looking to have counties or other entities kind of like veer away from current processes. And so, that kind of brings up the scenario that I was asking about, like, what if someone is deemed ineligible for Medicaid? Whether someone can sign an attestation saying, oh, hey, that's no longer the case. I actually am eligible because of A, B, and C. That's a really good question. And it's something that we will take back to the team and talk about.
Okay, great.
Thank you.
Thank
Thank you for
you.
bringing that up. I
Yeah.
appreciate that.
I do have a question in that eligibility piece. Is the coordinator that is gathering all of the verifications needed, they're going to funnel those directly to the county for review? Are they reviewing them and data entering them in CBMS? How is that piece going to work together?
Great question, Kinsey. I'm really glad you asked that because I didn't say this part, so I'm glad you asked. So what we're looking at is this. Let me go back a slide. So the top orange, the enrollment coordinator, will be the point of contact between the county and everybody else. And so just to kind of help streamline on the county side, we feel like it'd be easier for this one person, this one entity, the top person to be the point of contact. And so our vision is that, as verification documents, medical documents come in, that the enrollment coordinator at the top would be the one to receive those and provide those to the county.
Thank you.
Thank you for asking.
I also had a couple questions.
Sure. Thanks, Katie.
Yeah, the first one was just, I'm thinking about that coordinator and working with the counties. And one of the challenges that sometimes comes up is making sure that the right release form is present so that the counties know that they can speak to that person. We've had some, over the course of the unwind, we've heard a lot of reports of, a certain county not accepting a form that HCPF uses. And so I think that's going to be one of the challenges to work through. And then the other piece is when thinking about the eligibility of the person during the PE period, if they are found ineligible, will they receive a termination notice of that PE? And even if it's happening later, what I'm really thinking about is the accessing continuing benefits if that person were to appeal. Like, I would certainly suggest that if they receive presumptive eligibility, appeal rights should be triggered. If they're determined ineligible, right, that would trigger their appeal rights. And so I'm thinking about the scenario where, maybe you all decide, okay, you get PE for 90 days, but on day 91, you don't have services. If you file an appeal, before that 91st day, do you get to continue your benefits throughout the course of the appeal? So those are some of the questions that I think need to be worked out. Thanks.
Great questions, Katie. Thanks for bringing that up. So I will say that as far as, denial for Medicaid eligibility, that process will remain in place. Someone can appeal that decision. The notices of action will kind of remain in place for Medicaid eligibility. As far as appealing LTSS presumptive eligibility, what part of our process in working through the development of program plans and recommendations was looking at other states. The states that currently have presumptive eligibility in place for LTSS PE include Washington and Rhode Island. We know that CMS has approved their presumptive eligibility program, so we've been largely using them as guidance for us. So, as it currently stands, presumptive eligibility is not an appealable benefit. It's not an appealable service. Someone can file a grievance, but not an appeal. So, right now, we're not looking at having LTSS PE be appealable. And so, that's why it's kind of, that's why this part, what happens if the second bullet point, what happens if someone is determined ineligible for Medicaid, what can happen with their services? That's why we're looking at this really hard, because we know that PE isn't historically appealable. And so we just want to see maybe what can come into play to help these individuals. Did I answer your question, or is there more that I can talk about?
No, that's helpful. Thanks.
Thanks for asking.
I do have another question.
Please, yeah.
Our third party community partners, such as Express Eligibility, or CMAP, that also practice long-term care, are those entities interchangeable with county receiving the application?
This is a good question. And I saw that my manager is here also, Matt Bohannon, and I saw he came off mute. And so maybe Matt has something to say about that. And thank you for asking.
And can I just confirm, you're talking about whether or not your organization works with its own MA site as opposed to counties for determination of long-term care Medicaid?
Right. So I'm with the county.
Okay.
However, there are other third parties that process applications, primarily, speaking of InnovAge processing PACE, when sometimes CMAP does also process those applications. So are those entities interchangeable with this designation in green as the entity that the coordinator is going to work with on those verifications?
Thank you. It's a helpful clarification. And just a couple of layers to tease out. So we will be utilizing the same processes that are currently in place for HCBS determination. So it's my understanding that statewide, we are very typically doing that through our county partners, and so that would remain. As far as our third-party entities go, we do not attempt to be exclusive. So if there are third-party entities that are involved in your organization's determination, we would certainly work with you to ensure that we weren't doing anything to change that process. However, we're also not bringing anyone new on board. So we are not planning to introduce third-party MA sites where there are not already MA sites in place with that responsibility. And then just the last piece to tag on to your question, since PACE is not currently connected to presumptive eligibility for several reasons, those individuals who are processing specifically for PACE, such as at InnovAge and so on, they wouldn't be included either, just programmatically. So hopefully does that help?
Yes, absolutely. Thank you.
Thank you, Matt, and thank you all for these questions so far. I'll move on for now. If anything else comes up, please don't hesitate to speak up. All right. And so here are some of our most immediate next steps as far as implementation. We are continuing to outreach our partners, our stakeholder groups, to provide education, prepare for what's coming up as far as how everyone will be affected by the implementation of this new program. In fact, we are kind of in the next phase. We did a really rigorous round one of engagement and outreach to lots of different groups. And so now we've kind of had a slight dip in our targeted outreach schedule. And now we're really looking forward to a big round 2 of outreach. We are already drafting additional documents for CMS. They have not given us any response or questions yet, but we are just kind of being proactive about drafting an implementation plan, for example, a program manual. We are looking for and working on drafting any responses to the 1115 that are being posted during this 30-day public comment, public review period. We are working on facilitating regulatory language changes with our appropriate state authorities. We are doing a lot of continued internal collaboration on system updates, policy alignment, and really 100 other pieces of program minutia internally that we're continuing to flesh out. And we are really excited about developing some training materials and other documentation needed for all of you to help to make sure everyone is informed and prepared for this program. And so I really wanted to take this opportunity to to hear from you all. You've already posted, or I'm sorry, you've already posed a lot of really good questions, some good feedback. And so we would like to hear from you, number one, on just, what comes up about this program that you're thinking about, what questions do you have? And number two, as you think about yourself and maybe the group that you represent, what would you like to have in place as far as getting ready for this new program? What kind of information, what style of communication is best for you? Do you like emails? Do you like webinars that are posted on the website with a link? Do you like meetings like this? And so right now the floor is yours to provide any feedback, ask questions. And while you are formulating those, I'm going to stop sharing my screen and post the links in our chat that I talked about, that I referenced throughout this slideshow. Don't be shy about speaking up. If you have a question, if you have a thought, just like they used to tell you at school, you're probably not the only one. So feel free to speak up, or I am looking at the chat now, and so you can type a question in chat if you prefer. And then right now I am entering a whole bunch of information in chat. There's a link to the House bill that gave us legislative approval to include presumptive eligibility for the LTSS PE population. There's a link to view the 1115 as well as the public comments, and eventually will be responses. There is the link to the LTSS PE website that we are continuing to update as developments progress. And then we also have an LTSS PE email inbox and a voicemail line. Yeah, go ahead, Katie.
Thanks. I had two questions. The first is if you could talk a little bit about the training that those two new roles, the enrollment coordinator and the facilitator person will have, because it sounds like the enrollment coordinator needs to be somewhat of an expert on LTSS eligibility, and the facilitator needs to be an expert on waiver services and all of those kinds of pieces. So I would love if you could talk a little bit about that, and then I'll hold my second question till after.
Yeah, thanks so much, Katie. Yeah, so absolutely, you're right on as far as some really extensive training will be needing to happen for those two entities. I will say that as far as I'll answer this second part first about the facilitator. I mentioned that this will be an entity who provides a really intensive model of support. We currently have within our landscape of services transition coordination agencies, and so these are who we are kind of thinking will hold this role. They may not be the only ones, but we have already started holding a series of work group meetings, both with leadership from counties and case management agencies, as well as leadership with these transition coordination agencies, really talking about this. And everyone is kind of slowly, being trained and informed about what to expect. As far as the formal training, absolutely, there needs to be a really solid line of communication to make sure everyone is on the same page with timelines, regulations, what's required, like what does this mean? What does the county actually need to process financial eligibility? So we totally agree with you, especially what you said about that enrollment coordinator, the person who receives the application, definitely an expert on eligibility processes. So we're definitely thinking through that. All of the involved entities will start meeting together just to make sure everyone is in alignment with timelines and processes. Yeah, did that answer your question, or is there more to it that I can talk about?
Yeah, I think so. That's helpful. I'm assuming that there's going to have to be some rulemaking at some point once CMS has gone through. And I was also curious about just the stakeholding that'll be done for sort of the creation of these folks and what responsibilities they'll have. But my second question was, and I think I've asked this in previous meetings, but I'm wondering what happens to the people whose application is not processed in 90 days. Just because that's been a real problem for the last couple years with the unwind, and ARG, the vendor that does the disability applications, has been really far behind for a long time, and 90 days, it's just not happening. So I'm just curious about the loss of services that will happen for those folks and sort of how that can be dealt with.
Thank you. Thanks, Katie. So as far as I'll answer the ARG part first. That has in just about every meeting, every opportunity for feedback that we have hosted, ARG has come up repeatedly. So we very much know that this is something that we need to address. Currently within the department, there is kind of an escalation or expedition process in place for more emergency ARG applications. We have someone within the department who works really closely with ARG and is able to to be flagged for those who really need their ARG determinations to go to be processed in a quicker timeline. And so we don't have the exact parameters of this mapped out yet, but one example might be that the enrollment coordinator would be keeping track of those who need an ARG determination. And let's say, for example, at day 45, if the ARG application hasn't been approved, then this individual within the department would be flagged and it would be escalated at that point. So we very much intend to put something in place to help mitigate any extensive timelines associated with ARG. As far as what happens at day 90 if someone's eligibility is not determined. Federally, we are not allowed to extend presumptive eligibility beyond day 90. And so what our plan is to do everything that we can on the front end to help streamline these processes, to make it easier for the counties to do their part, to make it easier for the case management agencies to do their part. The enrollment coordinator will start really day one talking as they talk with the individual to say, all right, here's what you need to have in place. Here's what you're going to need. This facilitator, TCAs, or whomever will be helping you, walk alongside you to submit these ideally by the 10th day after enrollment onto LTSS PE. And so don't have a good answer as far as what happens at day 90, other than we are going to be doing everything we can on the front end to streamline and ensure adherence to that timeline. Yeah, go ahead, Matt. Thanks.
And I just wanted to pause. We have a couple of chat comments, so I wanted to steer towards those. And I would just echo what Amy is saying. We're really working internally to see how we might identify this program separately to mitigate some of those issues. And as far as the work with CMS goes, in our request, we are advocating for the ability to look at longer time periods, but we do want to be very transparent and honest that even though we're not defining a specified time period within CMS's request, that we are very well aware that ultimately we will be bound to whatever they allow, and precedent to this point shows that they are looking pretty tightly at that 90-day timeline. So that's where, to Amy's point, once we have more information about that and what our path looks like moving forward, we'll be able to work more closely with you to identify whether or not we need to do better to support this up front and what that looks like, or if we have a little bit more runway. And so to go to the chat comments, we had a couple of kudos. I love the videos on the website with the links. Operational memos, Julie Miller for CMA's operational memos are used and very helpful for clarification. So to your question of how do you want to be reached? Very clear roles and training will be vital for sure. That's also from Julie, and acknowledging that this seems to be off to a good start. And then building on the last question, I just want to pose this to see if Becky feels like this was resolved by the former discussion. Is the disability criteria client statement, or will they need an arbor for PE if not declared by disabled by SSA? Becky, did our conversation at least provide the level of information needed for the time being until we can have a more robust conversation about that?
Yes,
Perfect.
thank you.
And then Amy, last on our chat list, we have a question from Kinsey. If the client is found eligible for LTC within the PE timeframe, but begins serving a POI, will the PE services stop or continue as minimal services during the POI? And if I can, Amy, I would just say that that's a fantastic question. I think that that's something that we need to probably talk more specifically as we dive into how each of your organizations approaches these. A POI, as far as what that might mean operationally, is not necessarily a case that we've sort of worked through and identified. So I would love to talk with you more and kind of understand what that would look like differently than the denial situations or the approval situations. So let's definitely take that question down. And then we got another one from Sherry. I would also encourage training for service providers so that we can have a clear understanding of process and billing for services provided, as well as what happens if a member is deemed ineligible after PE. I think that that is a very fair and valuable piece of feedback. Training is definitely a priority, and making sure that we outreach everyone is critical. So thank you. We will certainly note that. That covers our comments, but I do see a hand up from Megan Bowser.
Yeah, thanks. I just wanted to piggyback a little bit on what Katie Wallet had mentioned too about the timelines for applications right now as well. I think part of what's so exciting about this program is we have seen the application process for many long-term care waivers take a really, really, really long time in this past year and a half. And so having some fill-in is good for that immediate 90 days, but I'm hoping that this can actually more systematically escalate those cases that really are in crisis ongoing. And so I would just reiterate and really encourage you guys to come up with some really solid systems for making sure those happen within that 90-day time frame and get appropriately escalated, and have really solid systems around that, because I have very few clients that are getting through the process within 90 days right now. It is the minority by far at this point in time. And so, but those in crisis are the ones that absolutely need it as soon as possible. So I hope this can have an added benefit too of properly escalating those and giving this presumptive eligibility services within that application process timeframe as well.
There are a couple more chats. I did see LaShawn's hand go up first, but since Katie's question is very specific to the 90 days, let's take Katie's question and then go to LaShawn. While I understand that Rhode Island and Washington have not made PE have appeal rights, I don't know that those states have the timeline concerns we've seen over and over during the last 2 years. I urge the department to consider including appeal rights for PE. Otherwise, there will be people who lose benefits at day 91 with no appeal rights for no fault of their own. And Amy, I know you already spoke to this, so if I can just reiterate, I think that that is an absolutely great feedback. And I think that that piece is something that we're really trying to evaluate on a couple of levels, and looking at whether or not there are challenges that can be overcome through offering service extensions in some way, shape, or form, or whether or not this is something that is kind of confined within the appeal rights discussion. Part of what we're looking at, just so that you're aware, is that because this is an attestation process, it's not necessarily based on any formal determination. And so therefore appeal rights are not extended in the same way that they would for an assessment that does come with a determination for long-term care Medicaid. And so that's where what we were talking about before is looking at whether or not there's a way to operationalize this such that the Medicaid application begins concurrently, or at least close to the timeline of the PE application. That way, the PE referral allows that member to receive some services regardless of the ultimate long-term care Medicaid denial. That service offering will continue until a Medicaid determination has taken place. So that's where, once that denial comes in, they will absolutely have the ability to appeal that, and that would give us the ability to actually offer more of the concerted review process so that it does go through the formal review. And we still have a lot to think through. So I think that your feedback is very well taken and something that hopefully we can continue to talk about.
And I did know, LaShawn, you had your hand up for a second. Thank you, Matt, by the way, for that. And thank you all for the questions. Did you have a question, LaShawn?
A question and a comment, and I actually pulled it down, but I think it's worth saying. First of all, I want to echo the sentiments of a lot of the participants here. I think that we are starting, this is a good process. I'm excited to see how this rolls out and how transition coordination agencies and other providers can be a support to the state in making sure this is successful. I guess my question goes, and I've brought this up before in other meetings, of unanticipated consequences to this process. I know right now, as others have echoed, how long it's taking to get these services started. Transition coordination agencies are beginning to get backed up in their in that TCM expense and setup. Right now, I know my agency right now, we're $10,000 in, still waiting to get reimbursed for household setup, which hinders us from being able to support other HCBS approved members with moving out, because those funds are not becoming readily available for us to recreate those. I've spoken with other agencies. There's an agency that right now is $14,000 in. And again, they're hesitant to transition any other more members because it is a financial hardship. What are we putting in place in these extreme circumstances where it is taking longer than 30 to 60 days, even towards the 90-day process, for agencies to get reimbursed back for those transition setup and household fees? Secondly, I guess my next question is, if we provide those services to a member under presumptive eligibility and then they're turned around and denied, what are we putting in place for those agencies who have spent money for individuals to move out and cannot recoup that because they're not eligible at this point?
Thank you, LaShawn. Those are really good questions. I'd like to answer the second question, and then maybe, since Matt works so closely with the transition coordination process, he can address the first question with you. As far as what happens with service providers if someone is found ineligible for Medicaid during the PE period, as part of our 1115 request and budget request specifically, payment for those services rendered during the PE period, regardless of someone's eligibility determination, is in place. So service providers will not be out any payment for any of the services provided during the PE period.
Just to piggyback on that, one of the other recommendations that goes in tow with that is that when we're looking at the PE services, we're talking about a lot of lessons learned. And so we do hope that ideally, especially for these programs as a starting point, that these members do have a more streamlined process. And so that when we're talking about the actual HCBS authorization, this eligibility program has hopefully addressed a lot of those concerns to eliminate some of the risk that we are seeing. I want to acknowledge that that is a challenge right now that I know that you're facing. The other part of PE is that when we're talking about the services that we're offering, personal care, respite, home delivered meals. Our recommendation is that those services are all authorized in advance at a maximum level in a pre-established benefit plan. So if you're a presumptive eligibility member, the idea is that anyone coming into the program would have access to the same 6 services, for example. All of those services for everybody would be authorized at a maximum amount, scope, and duration. And so there wouldn't be a need to wait for that service authorization to occur through any other entity. So we are hoping that by authorizing those up front and allowing you to engage billing right away, and then protecting against any sort of recoupment or payback situation for either the member or the provider, is a step in that direction, LaShawn.
I love it, but household setup and expenses are not part of those pre-eligible expenses that I know of.
And that's I think where I forgot that part of the question. Thank you for the reminder. I want to acknowledge that transition setup has come up in a number of different conversations, not just presumptive eligibility. And so that's something that we are looking at through a number of different lenses right now. And one of the things that I would say about presumptive eligibility, as I just alluded, we're working through a lot of lessons learned. And so where there are some things that we're talking about here that may not necessarily fit into the package, we don't want to leave anything on the table. And so while we do acknowledge that presumptive eligibility is targeting a very specific group of people with a specific goal in mind, for things like that, we do want to ensure that if it's not possible within presumptive eligibility, that we are looking at it through other lenses. And so within the context of the transitions program, I think that that is something that we will continue to talk about a lot more in the near future.
Thank you, Matt.
And then we have one more question in the chat. Did I interrupt somebody? I'm sorry.
Oh, I was just going to talk about the question in the chat, so go ahead.
Well, I'm kind of excited about reading them, so I'll read it and then you can answer it. In the event of a denial, is there going to be a sit-out period from PE if a client reapplies, or can PE begin immediately, or is the 90 days a lifetime benefit once offered?
So this is something that we have continued to talk about. Different states do kind of different things with that. I think our current recommendations sit at us not having a limit in place as far as how often someone can apply, although we haven't exactly addressed this specific notion in a few months. And so we're open to feedback on that.
I think the only caveat I would underscore is that the PE requirements are kind of threefold. So we have the attestation of functional eligibility, the attestation of financial eligibility, and then also the attestation that they meet one of the crisis situations. So I would just keep in mind that when we are considering whether or not a member should be reconsidered for this PE program, what we'll be looking at is whether or not this is a new crisis, whether or not there is something happening now that meets that criteria. And we need to think about it further in terms of making sure that it's consistently applied. So thank you.
I have a quick question.
Oh yeah, go ahead, please, Allie. Thanks.
I don't know if I may have missed it, but what kind of criteria are we looking at to constitute a crisis?
That's a great question. Thanks for asking. This specifically has, especially in the earlier days of trying to develop our recommendations, this is something that we asked for and received a lot of feedback on from our stakeholder groups. So currently what we're looking at are crisis situations such as a recent acute medical or mental health episode, being a danger to oneself or others, or a recent loss or incapacitation of a caregiver. Pat, I think I shared my screen again to show the mapping and process flow. So just speak up if you're not able to see that. anything else right now. These have been really fantastic questions and thoughts. Well, not hearing anything right now, so we don't have anything else to share at this time other than there is much more communication to come, especially as we start to hear back from CMS to further develop our parameters and guidelines and recommendations. There will be much more information to share about this program for all stakeholder groups. There will be lots to know, lots to learn, lots to be educated on. And so keep an eye on the LTSS PE website, which I put the link to in the chat. Always reach out to us if you have any questions or feedback, and we'll be talking to you about this again soon. I will stay in this meeting for a few minutes longer in case anyone wants to bring up something in a smaller group setting rather than the full number of people who are here. But thank you all so much for joining. Thank you for your support, for your partnership. Thank you for your interest in this program. It's something we are really, really excited about. It's been in the works for a long time, and it's just really, truly exciting to have this runway now to actually be able to move towards implementation in under a year. So thank you so much.
Amy, I had another question for you.
Yes, please. Thanks.
So along the lines, it sounds like a lot of the criteria sounds more mental health related, minus the death of a caregiver. In rural areas, we often have issues as is finding providers. Is there an incentive that you guys are offering, or that HICCUF or the state is going to be offering to providers to enroll in PE or anything like that? How is this going to work exactly if we're already short providers? We have trouble sometimes as it is getting people to fill med boxes or coming in to do housekeeping or personal care. A lot of agencies are legitimately pushing relative personal care, IHSS, CDAS, because they just don't have the staff.
Yeah, I hear that, Allie. And I think, thanks for bringing that up. Where we see the value lying with our service providers is that the individuals who need services right away during LTSS PE will have, be kind of easier to get them up and running. They'll have support of the TCAs, of the program facilitators to, be up and running, serve as a point of contact. We are allowing recommending to allow relative care as one of the included services. As far as like a monetary compensation, that's not something that we believe is allowable, although it's something that we have certainly been discussing. And once someone is, if a service provider is providing services during the PE period, as someone enrolls onto HCBS, it'll be kind of a low lift for the service provider agency, as the individual will already be on services, already connected with the service provider. So the benefits are strong for provider agencies within this program. And I think there's an aspect that you asked that I'm not remembering right now.
Also just offer, I think a lot of this is awareness and communication. And so, Amy pointed to the fact that we've spoken with 47 different groups in some fashion to this point. We have to do a lot more with that because some of those values are going to be very, very high, but not necessarily apparent. And so recognizing that a lot of the provider issues right now are subject to the delays that we're seeing with PARs as one of the reasons we are hopeful that by putting it out there that this is a program that can initiate billing and support right away, that will be a barrier removed for some of the providers. We also recognize that rural areas have challenges apart from simply PARs. And so I think we need to invest a lot more concerted conversation into figuring out how we can apply this model in a meaningful way. But the rural areas are something that we are very that we are very committed to looking at. We know that if we could create the shiniest system in the world, but unless it actually has people to provide the service, then it doesn't do what it needs to. So we will definitely want to work more with you on those things.
Right. And then, so in terms of PARs, are we saying that, I mean, I know we don't know a whole lot, but PE won't need a PAR necessarily for the provider to bill? Will it be different? And then when they come onto a program or a waiver, then a PAR would be put in place through the CMA?
Yeah, so the thought is that we would avoid the standardized PAR process. And so as we
That would be great, because what the CCM is, you know, it's broken. And then you get the whole thing where Peak Pro, here are known issues. And with all these, you know, different, this talks to this, talks to this, talks to this, along with ARG and, you know, the counties being behind with getting financials in and that whole big delay. A lot of our problem currently is the PAR delay because of the system issues, you know, and so bypassing that would definitely make things go faster for PE for sure. But then when they get on a waiver, it's a conversation to have with the providers that you may not get a PAR right away because we still have system issues. And I don't know if that's going to be fixed by January 2026. We've had the system now for a year and a half already, and it's still not working like it should. So just something to be aware of on your guys' end as well.
appreciate that feedback. Thank you.
Absolutely. Sorry. Okay. Have a great day. Thank you so much.
Hey, Allie.
For all the feedback
Bye.
and questions, Allie, we appreciate it.
LaShawn
Not a
has another
problem.
question. Will
Will this
CFC waiver providers be eligible?
Yeah, so given that a lot of the services that we want to include with the LTSS PE, in fact, all of them currently do fall under the CFC umbrella. So the answer to that is yes. It's the short answer. We just have about 2 minutes left in this meeting, and so in the last couple of minutes, is there anything else? Any other questions? Any other feedback? Great. I'm not hearing anything at this time and not seeing any additional questions in chat. So again, just a big word of appreciation to you all for joining, for your interest, for your support. And we can't wait to be able to share more information and more updates about this program as we're able to. Have a nice rest of your Thursday, everyone.
Thank you, everyone. Great job, Amy.